Good day, everyone. I am Nicole, and together with my groupmates, we were here to discuss to you and gives you basic knowledge about the medical field. So, why it is important to have a basic? Basic is the most important for it builds you a foundation of knowledge in specific field. In medicine, it helps in effective communication between the staff and the medical professionals to work efficiently, fulfillment of their role. Today, in this presentation, we were here to discuss the principles of ethics and law in medicine, the basic medical terminologies, the basic medical forms, instruments, and supplies, the billing process, and the requirements that you need to acquire in applying field health insurance claims. So, hope you will learn something today. Now, we will welcome you to our discussions. Everyone, let's get started. Now we will discuss about medical ethics. So what is medical ethics? Medical ethics is concerned with the obligations of the doctor and the hospital to the patients along with the other health professionals and the society. It is the practice that is not the applications of the rule, but the careful considerations of principles in a complex world of decision making about human action. In respect to this medical ethics, we represent to you the pillars of medical ethics: autonomy, beneficence, confidentiality, do no harm or non-maleficence, equity, and justice. What is autonomy? Includes veracity and fidelity. Veracity is the honest disclosure of patients' conditions. Fidelity is respecting the confidentiality of the patients. These pillars would be brought up the key concepts that are relevant that could be brought up to demonstrate the knowledge of the capability of the doctor doing the right thing. In autonomy, the idea of self-governance is important, that an individual has the right to make a decisions and act according under a self-chosen plan. In medicine, this specifically refers to the fact that the patient has the right to deny any treatment that is offered to them or choose between different treatment options available. Note that although patients has autonomy, they cannot demand treatment that is not offered as an option. Next was beneficence. Beneficence is an act in the best interest of the patients. This means that the doctor should maximize the benefit that the medical care has on the patients. It is trying to act in the patient's best interest, which might not always be clear as you would assume. If you talked about it, the doctor must act in patient's best interest. Here, you want to assess whether the operation will do her any good. It would be important to assess her physical health for you to know and understand its conditions. Confidentiality. Maintaining confidential information confidential. Maintaining confidentiality is both a legal and ethical responsibility of healthcare professionals. Generally speaking, doctors may not be disclose any patient information without the patient's consent. However, confidentiality is not absolute in some situations, will warrant breach of confidentiality. If patient confidentiality is likely to put a human life at risk of harm, then as a doctor you must weigh up the pros and cons of breaking confidentiality. Next was the non-maleficence. Above all, do no harm. Non-maleficence is the sister to beneficence and is often considered as inseparable. It states that the medical practitioner has the duty to do no harm or allow harm to be caused to a patient through neglect. Any consideration of beneficence is likely, therefore, to involve an examination of non-maleficence. Justice. According to Aristotle, justice is giving to each that which is his due. So this principle states that when considering whether an action is ethical or otherwise, we must consider whether it is compatible with the law and the right of an individual, and whether it is fair and balanced from societal perspective. This means that the decision about what treatment to provide to whom needs to be taken extremely careful. It also means that we must ensure that no one is unfairly disadvantaged when it comes to access in healthcare. Justice and medical ethics can be extremely complex as a pillar to be considered. After knowing the pillars of medical ethics, let's proceed to what we call the medical law. What is medical law? Medical law is the body of laws concerning the rights and responsibilities of medical professionals and their patients. The main areas of focus of medical law includes confidentiality, negligence, and other torts related to medical treatment, especially medical malpractices and criminal law and ethics. Medical malpractice is to be considered medical malpractice under the law. The claim must have the following characteristic. First, a violation of the standard of care. Second, an injury was caused by the negligence. Third, the injury resulted in significant damages to the patients. Here are some examples of medical malpractice. First, misdiagnosis, surgical errors, failure to treatment, birth injuries, prescription drug errors. These are the common types of medical practice seen by the medical professionals.
Hi, I am Jenny Manlambus and I am here to talk to you about some medical terminologies which I divided into five parts: branch of medicine, medical root words, medical prefixes and suffixes, medical abbreviation and acronym, and some medical terminologies. Now let's focus first on branch of medicine. First is pathology. Pathology is the study of the causes and effects of disease or injury. Pathology is one of the branch of medicine. It concerns with all aspects of disease, but with special reference to the essential nature, causes, and development of abnormal conditions, as well as the structural and functional changes that result from the disease's processes. Next is endocrinology. Endocrinology. Endocrinology is the study of hormones. Endocrinology also deals with the diagnosis and treatment of diseases and disorders of the endocrine glands, like conditions affecting the thyroid, adrenal glands, pancreas, thymus gland, etc., which you can see in the picture. Now let us come to the next point, which is hematology. Hematology is the study of blood, blood-forming organs, and blood diseases. Hematology deals with the diagnosis and treatment of diseases of the blood and its cell components. Lastly is genetics. Genetics is the study of heredity. Genetics concerns with heredity, especially the mechanisms of hereditary transmission and the variation of inherited characteristics among similar or related organisms like DNA. Pathology, endocrinology, hematology, and genetics are one of the branch of medicines. I now I now like to move on to the next topic, which is medical root words. Root words are a basic word to which affixes the prefix and suffix are added. It forms the basis of a new word. First root word is pulmon. Pulmon refers to lungs. Pulmon refers to lung respiratory organ situated inside the pleural cavity of the thorax. Example, pulmonary edema and pulmonary veins. Pulmonary edema and pulmonary disease is, for example, pulmonary edema is a condition caused by excess fluids in the lungs. This fluid collects in the numerous air sacs or alveoli in the lungs, making it difficult to breathe. In most cases, heart problems cause pulmonary edema, and pulmonary disease is a type of disease that affects the lungs and other parts of respiratory system like lung cancer, asthma, pneumonia, pulmonary edema, etc. Next is aden. Aden referring to a gland as in adenoma and adenopathy. For example, adenopathy. Aden is a root word and pathy is a suffix means disease, which adenopathy is any disease or inflammation that involves glandular tissue or lymph nodes, which you can see in the picture. In other words, adenopathy is a disease that occur in the gland. And now the last root word is accusis. Accusis, condition to perceive sound and hearing. Accusis, example, hypoaccusis. Hypo in a Greek word means under or less than. Thus, hypoaccusis is hearing that is less than normal, or in other words, a hearing loss. Some of the cause is aging and exposure to the loud noise. It also because of earwax. Now let's move on to the next topic, which is medical prefixes and suffixes. Prefix is an affix which is placed at the beginning of one word that changes into another word, and suffix is placed at the end of one word. Suffix is the opposite of prefix. First prefix is this. This prefix denoting abnormal, difficult, painful, or bad. This is a prefix word means painful. Example, dysmenorrhea. This is a painful. Menorrhea is the flow of blood at menstruation or menstrual periods. In other words, dysmenorrhea is a pain with menstruation. Next is ectomy. Ectomy is a suffix meaning removal of an anatomic structure. Example, appendectomy. Appendectomy is a surgical operation in which the appendix is being removed because it becomes inflamed or filled with pus, which we call appendicitis. Appendectomy may be performed using laparoscopic, an instrument to look at the abdominal organs. Next medical prefixes is anti. Anti prefix denoting against, opposite, or counteractive. Example, antibiotics. Antibiotics are medicines that help stop infections caused by bacteria. Example is amoxicillin, which you can see in the picture. Amoxicillin is an antibiotic to treat a number of bacterial infections. Now let's move on to last suffix. Phobia. Phobia combining form denoting abnormal fear of. Phobia is a type of anxiety disorder that causes an individual to experience extreme irrational fear about something or situation. Example, acrophobia means fear of height. Another is hemophobia, fear of blood, etc. Acro means height and hemo means blood. Now let us come to the next topic, which is medical abbreviation and acronym. First is DNR. DNR, do not resuscitate. DNR means do not resuscitate. DNR or do not resuscitate is a medical and legal order written by a doctor. It instructs healthcare providers not to do cardiopulmonary resuscitation or CPR if a patient stops breathing or if the patient starts beating. Next is ECG, electrocardiogram. ECG machine records the electrical signal from your heart to check for different conditions. Sensors are attached to the skin are used to detect the electrical signals produced by your heart each time it beats. AC before meals, PC after meals, QID 4 times a day, QD once a day, Q3E Q3H every 3 hours. AC, PC, QID, QD, Q3H are used in the context of prescription drugs or medicines which a patient or someone will take. LBW, low birth weight. LBW is defined as a birth of an infant that weight of less than 2,500 grams or 2.5 kilo as per the World Health Organization. LBW is most often caused by premature birth. And now I'd like to move on to the last topic, which is a medical terminology. First is benign. Benign, it refers to a condition, tumor, it growth that is not cancerous. Benign, a mild type or character that does not threaten health or life, especially not becoming cancerous. Example is adenomas. Adenomas, a common type of adenoma is a polyp in the colon, which you can see in the picture, the difference of normal colon and colon polyps. Adenomas are benign tumors starting in the epithelial tissue of a gland or gland-like structure. The epithelial tissue is the thin layer of tissue covering organs, glands, and other structures. Next is malignant. Malignancy. It refers to the presence of cancerous cells that have the ability to spread to other parts of the body or to invade nearby and destroy tissue. Malignant used to describe cancerous growth that will spread to surrounding tissues and if not totally removed may be fatal. Example, lung cancer. You can see in the picture the difference of a healthy lung and a lung that have a cancer. Cancer is a disease in which cells in the body grow out of control. Lung cancer begins in the lungs and may spread to other organs in the body. Benign is not a cancerous and the tumor is normal, while the malignant is cancerous. Now let's move on to the next terminologies, which is epidemic and pandemic. Epidemic is a disease that affects a large number of people within a community or region. Example, a disease that spread in Metro Manila only is called epidemic, while pandemic occurring over a wide geographic area and typically affecting a significant proportion of the population. Epidemic is occurring over a wide area like a country. Example of this is COVID-19. COVID-19 spread in the country like Brazil, Italy, United States, Philippines, China, etc. The picture that you can see is the map of the world and the red colors is how many coronavirus cases, deaths, and recoveries in each country according to the Graham Media Group. Next is the last medical terminologies which is inpatient and outpatient. Inpatient, a patient who stays in a hospital while under treatment. Outpatient, a patient who receives medical treatment without being admitted to a hospital. Inpatient is once you have been formally admitted to a hospital either a day or overnight, while outpatient is anything where you're not formally admitted to the hospital. That's all. Thank you for listening. Again, I am Jenny Manlambus and I hope my presentation will help you with what I said at the beginning. Thank you.
I would like to present to you my topic is all about common medical forms, instruments, and supplies. Next is So, common medical forms. Medical forms can be categorized as tools used by medical practitioners as means to gather information and consent from the patient of their families in order to provide the treatment to the patient without any direct legal consequence to the medical practitioners themselves. So, medical medical forms are is medical records or medical forms are part of the very chain and are considered as the most important part of the hospital management system. And whatever the type of this medical forms it is, each and every medical forms carried important and it must be filed properly. And next is I would like to show to you my example of medical forms. First is medical history form. So what is this is the medical history form. So what is medical history forms? May include information about illness, allergies, um, surgeries, and immunization and result of the physical exam and test. It include about medicine taken and health habits and such as diet and exercise. Next is dental assessment forms. So a regular dental visit basically involves assessment of teeth. For this purpose, a dental assessment um, is present the dentist office such he use as a checklist to know the current health status of the teeth. Next is release forms. Is a document that gives a healthcare professional permission to share patient medical information with other parties. Next is registration form. It is a data sheet in which um, we enter the basic information of the patient to use if it for healthcare or healthcare purpose. Next is patient exit form. This is used by those people who were admitted to the hospital for a particular treatment and now they want to exit of after the procedure has been completed. This form is kept as a record that the patient has exited the hospital after clearing all the pending dues. Next is authorization form, a document that is duly enclosed by an individual or organization with the uh, grant permission to another individual to proceed with certain action. Next is common medical instrument. So, common medical instrument is an instrument used in the practice of medicine by vocabulary.com. First is the first example is syringe. Next, laryngoscope, surgical scissors, speculum, stethoscope, rhinoscope, bedpan, gas cylinder, bronchoscope, keratoscope. So what is the use of this medical instrument? So syringe is used in withdrawing or injecting fluids or cleaning wounds. Next is laryngoscope. It is used for examination the larynx. Next is surgical scissor. This is used for dissecting or cutting. Speculum. Um, the speculum is the use of this for dilating a bodily cavity or passage to permit examination of its interior. Next is stethoscope. It is for listening to the sound mode with the body like heartbeats and lungs. The intestinal movement or breath sound. Next is rhinoscope. It is used for a special instrument used to examine the nasal passage. Next is bedpan. A bedpan, a shallow vessel placed under a bedridden patient to collect feces and urine. Next is gas cylinder. This is for to supply the oxygen, nitro oxide and carbon dioxide, and uh, bronchos, bronchoscope. Bronchoscope, an instrument for examining and providing access to the interior of the bronchial tubes. And next is keratoscope. It is used to assess the shape of the uh, an- anterior surface of the cornea. Next is uh, medical medical supplies. So what is medical supplies and what are medical supplies? So next, so what is medical supplies? So medical supplies is an item of it's an item for um, for medical supplies is an item for medical use that are suitable for use in um, healthcare facility or in home, and that are disposable or semi-disposable and are non-reusable. So medical supplies is the more common term for medical equipment, also known as armamentum and armamentarium. So what is armamentarium? It is defined as the complete equipment of the physician or medical institution, including books, supplies, and instruments. So next is this is the example of medical supplies. First is cotton wool, so used to stop the prevent bleeding from minor punctures such as injections or um, venipuncture. Next is surgical mask. Next is stethoscope, scales to know your weight, and temperature to monitor your body temperature. Next is eye chart. So next is blood blood pressure monitor to monitor your blood. Oxygen mask. So what is oxygen mask? It is a device worn over the nose and mouth to which oxygen is supplied from a cylinder or other source. Next is plaster tape. It is referred to all textile adhesive bands that are used for wound treatment for or for treating disturbances in movable movable joints. Next is bandage, a piece of material used to dress a wound, bind a broken limb. Next is folding stretcher, and the defibrillator. So defibrillator is to correct arrhythmia arrhythmias of the heart, or to start up a heart that is not beating. And last is wheelchair. And that's all. And thank you for listening to me. And that's all my report. Thank you.
So now, I'm going to discuss to you the different health forms of health insurance. Let us discuss first what is the meaning of health insurance. Health insurance is a type of insurance coverage that typically pays for medical, surgical, prescription drug, and sometimes dental expenses incurred by the insured. Health insurance can also reimburse the insured for expenses incurred from illness or injury or pay the care provider directly. In health insurance, it covers the whole part of the risk of a person incurring medical expenses, spreading the risk over numerous persons. It is estimating the overall risk of health risk and health system expenses over the risk pool. An insurer can develop a routine finance structure such as monthly premium or payroll tasks to provide the money to pay for the health care benefits specified in the insurance agreement. The benefit is administered by a central organization such as government, agency, private, business, or non-for-profit entity. Second one is what is HMO? HMO stands for Health Maintenance Organization. This organization is a network that provides health insurance coverage for a monthly or annual fee. HMO is made up of a group of medical insurance providers that limit coverage to medical care provided through doctors and other providers who are under contract of the HMO. These contracts allow for premiums to be lower since the healthcare providers um, healthcare providers provide through doctors, or it allows advantage of having patients directed to. How HMO works. HMO is a It's either organized public or private entity. It provides basic supplement health services to its subscribers. It secures the network of health providers by entering into the contracts with primary care, physicians, clinical facilities, and specialties. So let's now go to the health forms of health insurance in the Philippines. Here are the organization that offers health insurance here in the Philippines. First is the Medical Philippines Incorporation. Let's see the online applications of this organization. They offer a membership of individual, family, or it's either VIP plan. Let's now click here to apply. You can choose between the two if you want to renew or if you are a new applicant. So next, they have the select type of plan, which is you can use ward, semi-private, semi-private without AHMC or small private. So we can choose one, semi-private. And then you can see the plan rates that they offer. This one. Continue. And then enter this so we can proceed to the personal information. And here you can encode your personal information. So next one, organization here in the Philippines is MaxiCare. This is the application form of MaxiCare. This one. You can see the personal information, payment option, the payer, personal information of the dependents, and the beneficiaries. And also it indicates the statement of the details. Next one is the insular health care. This is the application of insular health care. You can see the part 1 is the application information. The part 2 is information on the agreement. Part 3, information on the payer. Part 4, billing address. And Part 5, the life or group term. It also had authorization to furnish medical information. Part 6, you can answer questionnaire. This is the form or application form of insular healthcare. Next one is the East-West healthcare. Let's see the form or application form of East-West. This is the application form of East-West healthcare. You can, if you are a new applicant, check the new applicant. If you renew your contract, you will check the renewal. In the form, it indicates of name of payer, information on your personal information. And the last organization is AXA Health Max. This is the health form or application form of AXA.
policy owner information, user access requirements. These are the organization in the Philippines, or some organization here in the Philippines that offers um, healthcare insurance. You can search them online or in their sites if you want to know about them. If you know about them. So that's all. Thank you.
Good morning, everyone. I am John Michael Iv-Bom, fourth year Office Administration student from University of Makati under College of Business and Finance Sciences. Now, what I will be going to present or to discuss to you is the process and requirements for PhilHealth claim. Okay, my presentation are divided into two topics. First, what is PhilHealth, or how I will introduce to you the background of PhilHealth, and the second one is the process and requirements of PhilHealth claims. Okay, let's start. What is PhilHealth all about? The Philippine Health Insurance Corporation, or PhilHealth, is a government corporation attached to the Department of Health. It administers the National Health Insurance Program, which was established to provide health insurance coverage and ensure affordable and accessible healthcare services for all Filipinos. PhilHealth members are divided into two categories. They are the direct contributors and indirect contributors. Direct contributors, those are PhilHealth members which are employees with formal employment, kasambahays, self-earning individuals, professional practitioners, overseas Filipino workers or OFW, Filipinos living abroad and those with dual citizenship, and all Filipinos aged 21 years old and above with capacity to pay. And those indirect contributors of the PhilHealth, they are those members who are indigent identified with the DSWD, beneficiaries of Pantawid Pamilyang Pilipino Program or 4Ps, senior citizens, persons with disability, Sangguniang Kabataan officials, sponsored by LGUs, and all Filipinos aged 21 years old and above with capacity to pay premiums. So let's go on to my second topic, the process and requirements for PhilHealth claims. So these are the process and requirements for PhilHealth claims. For the step one, which is the condition. To be eligible to avail for your PhilHealth claims, when hospitalized, the following conditions must be met. First, payment of at least 3 months worth of premiums within the immediate 6 months of confinement. For pregnancies, availment of the newborn care package, dialysis, chemotherapy, radiotherapy, and selected surgical procedures, 9 months worth of contributions in the last 12 months is needed. Second one, confinement in an accredited hospitals for 24 hours due to illness or disease requiring hospitalization. Attending physicians must also be a PhilHealth accredited, and claims is within the 45 days allowance for room and board. Step 2. Required documents. You'll also be needed to submit the following documents before being discharged from the hospital for automatic deduction. First, requirement, a clear and updated copy of your member data record or MDR. If you are dependent, make sure that you are listed in the MDR. Second, an original copy of PhilHealth claim form, which you can get at PhilHealth Hospital or your employer. Third, your PhilHealth ID and other valid IDs. For the last step, step 3, claiming and post claims. As direct filing is no longer needed, submission of the documents to the hospital before the end of your admission means automatically deduction of your benefit from your total bill. Once your benefit have been automatically deducted, PhilHealth will send a benefit payment to notice to the address declared in your MDR. This details the actual payments made by PhilHealth relative to your claim or confinement. Keeping your PhilHealth up to date is important, as it will be a great help if you or anyone declared as your dependent requires hospitalization. Okay. I have an attachment here from Bicol Medical Center regarding their PhilHealth claims processing section. So this is the PhilHealth claims processing section of the Bicol Medical Center from Naga City. Okay, your frontline services, room 10, processing of PhilHealth claims. And how to avail of the service. First, the patient must submit discharge clearance, and the service provider for this is and receives the statement of account or SOA from the billing section and checks CF4 from the computer system if complete and verifies attached medical documents required. And retrieve the patient's PhilHealth papers from the patient's jacket and attach the SOA and discharge clearance. They edit CF2 and print CSF, instruct the members or patient's immediate relative, affix their signature over printed name and date signed from CSF, PBEF, and SOA, and they verifies the correctness of data after the member or patient signs. And the person in charge here is PhilHealth processing clerk, and it will take 15 minutes. Second step, receives the signed discharge clearance. The service provider will assign the patient's discharge clearance with highlight color coding for the exit guard verification that the patient passed through room 10. They gives instruction to the member or the patient to go back to the ward and present the discharge clearance to nurse on duty. And the person in charge here is the PhilHealth processing clerk again. It will take 10 minutes. Okay. In general, the process of patient PhilHealth claims in Bicol Medical Center. First, they print daily patient discharge report and attach the Philippine PhilHealth documents and forwards to receiving clerk. Second, sorts of PhilHealth claims for signature concern the doctors or medical practitioners. Third, verifies PhilHealth claims incompleteness of data and attachment of required medical documents. Fourth, scan and send PhilHealth claims through e-claims to PHIC Legazpi. And fifth, maintain to PhilHealth e-claims files copy in the stock room, and the person in charge here again is the PhilHealth processing clerk. The duration was 45 days. End of the transaction. Thank you so much for listening.
Now let's discuss about medical billing process. What is medical billing? Medical billing is the process of submitting and following up on claims with health insurance companies in order to receive payment for services rendered by the healthcare provider. Medical billing translates healthcare service into a billing claims. Hospital and healthcare facilities face a lot of hassle when it comes on settling payments with regards of insurance. Payments are considered settled when patients submit insurance details at the front desk of the hospital. But the hospital or healthcare facilities does not receive the final payment till the insurance agency settles the claims. Our medical billing service allow the hospital to take the backseat through the various steps involved in those process. In order to simplify the billing process and maximize the daily hassle, there are the following clear defined steps in medical billing process. But before that, let's talk about electronic medical billing. What is electronic medical billing? Electronic medical billing system is to regenerate an effective revenue management. Importance to the billing in the healthcare systems on effective medical billing system can decrease the pressures on physicians, the healthcare system. This leads to an increase in overall efficiency of the revenue cycle management. It helps the professionals to keep a hassle-free environment where it is a paperless system. It also keeps a privacy and confidentiality of the file for the patients, and it keeps a automatic billing system for an hospital. So what are the billing process? In medical billing process, it is a series of steps completed by billing specialists to ensure that medical professionals are reimbursed to the service. Depending upon the circumstances, it can take a matter of days or a month, or may stretch over a several years, while the process may differ slightly between the medical offices. Here is the general outline of medical billing workflow. First of all is the patient registration. Patient registration is the first step on any medical billing flowchart. This is the collections of basic demographic information on the patients, including their names, birth date, and the reasons for a visit. Insurance information is also collected, including the names of insurance provider and the patient's policy informations and numbers, and verified by medical billers. This information is used to set up a patient's that will be referred to during the medical billing process. The second one is the financial responsibility. It is a second step in the process to determine the financial responsibility for the visit. This means looking over the patient's insurance details to find out which procedures and services to be rendered during the visits are covered. If there are procedures or services that will not be covered, the patient is made aware that they will be responsible financially for those costs. The third process was the super bill creation. During check-in, the patient will be asked to complete form for their files, or if it is in return visit, confirm or update information already on the file. Identification will be requested, as well as the valid insurance card, and co-payment will be collected. Once the payment check out, medical reports from the visit are translated into the diagnosis or the procedure codes by medical coder. Then the report called super bill may be compiled gather thus work. Next is the claim generation. Claim generation is a medical biller will then use the super bill to prepare a medical claim to be submitted to patient's insurance company. Once the claim is created, the biller must go over it carefully to confirm that it meets the payer and HIPAA compliance standards, including the standards for medical coding and format. Next, claim submission. Once the claim has been checked for accuracy and compliance, submission is the next step. In most cases, the claim will be electronically transmitted to clearinghouse, which is a third-party company that acts as a liaison between healthcare provider and health insurers. The exception to this rule are high-volume payers, such as medical aid, who will accept claims directly from healthcare providers. Next was the monitor claim adjudications. Adjudications is the process by which payers evaluates medical claims and determine whether they are valid and complain. And if so, the amount of reimbursed that provider will receive. During this process, the claim may be accepted, rejected, or denied. An accepted claim will be paid according to the insurer's agreement, which by the providers. A rejected claim is one that has errors and must be corrected, and the claims rate as submitted. A denied claim is one that has payer refuses to reimburse. Before the last step, here is the patient statement. Preparations. Once the claim has been proceeded, the patient is billed for any outstanding charges. The statement generally includes a detailed list of procedures and service provided, their costs, the amount paid by the insurance, and the amount due from the patients. The last step was the statement follow-up. The last step is a medical billing process is to make sure that bills are paid by the patients. Medical billers must follow up with patients whose bills are delinquent and when necessary, send accounts to collections agencies. Now, let's proceed. So, here is a sample billing statement form. So, this is the picture that you saw in the billing statement. First was the medical group name, so the name of the hospital, the guarantor informations, the third is the account status, so what are the status of your account, payment due, the amount that you must be paid, 5 quick pay URL and code, so it can be used through QR code. 6 mail payment information, so you can email the hospital about your billing process. 7, the questions. 8, additional message. And E, statement message. It is for the e-billing, so it used as a e-billing forms. Next was sample of a patient statement payment coupon. So first, you can see the return address of which you can see the medical group name and its address. Guarantor's address in the lower part. Third, insurance of personal information. So third, you can see the insurance where you can check that checkbox. 4 was information's update. 5, a quick pay URL and a code. So same as a code for receipts. 6 is the statement due date. And the 7 was the patient's amount. Yan, patient's account. Information change form. So what is the information change form? In the information change form is written on the back of a patient statement payment coupon. So it updates your account informations if anything has been changed since your last appointment. So you can see the personal informations of the patients, their name, the dates of birth, address, the city, telephone number, and the insurance informations as well as the name of the primary insurance company, the insurance address, and the insurance ID number. And that's all for today. It's all about the medical billing process and hope you learned something about it.